It has been 14 months since the World Health Organization declared the COVID-19 outbreak a global health emergency. 14 months since the virus altered our lives and little to none has changed. It proceeds to attack the world and the number of COVID-19 cases is continually rising as of today. Many countries are on the verge of surrendering to the hands of COVID-19 virus, but several are also successfully fighting back. In this video, you will be introduced to some of the model countries that have flattened the coronavirus curves.
In 2019, New Zealand was ranked 35th in the world for its pandemic preparedness behind Indonesia and South Africa. As of April 15, 2021, there are only 2,591 total confirmed cases and 26 deaths in a population of 4.900 million people. The Prime Minister and Director General of Health appeared each afternoon on TV, giving detailed updates and repeating important information. Key messages such as "Stay home, save lives" were translated into dozens of languages. Alert level system was publicized, with graduated levels of response based on the threat level. National broadcasters were required to carry COVID-19 updates and information. All non-essential work stopped. School closed and even surfing was banned. Billions have to be pumped into the economy, largely through a wage subsidy scheme. Despite being ranked 35th in the world in terms of preparedness, they were able to successfully tackle the virus. New Zealand was an excellent example of how a nation can successfully deal with this kind of crisis.
Regarded as highly vulnerable to the virus, but the country's cost-effective containment strategy resulted only 352 confirmed cases and no deaths in a population of almost 100 million people in June 2020. As of April 13, 2021, Vietnam's Ministry of Health confirmed a total of 2,707 cases with 35 deaths. However, 2,445 of these cases have recovered. Rapid introduction of containment measures, aggressive and cost-effective control measures, assertive contact tracing, target testing, immediate isolation of suspected COVID-19 cases, and effective and transparent communication made them among the first countries to lift all domestic containment measures. Vietnam is a perfect example of how a developing country can fight a pandemic.
COVID-19 has killed just over 900 people in Australia, and the Australian government has been praised for its strong stance against the virus. With a population of just over 25 million, that translates around 36 deaths per million residents, compared to more than 1,000 in the United States. Australia closed its door to all but people and residents in March, with a few exceptions such as tennis players. Those that do come are forced to stay in a government quarantine facility for 2 weeks. The system is absolutely critical, says Australian government advisor and public health professor Jodie McVernon. She claims that the country got a lot of things right, such as fast touch tracking and a generous social safety net. Australia is a true success story of how a First Nation country is focused on long-term gain over short-term gain. Flattening the curve of COVID-19 has showcased each unique and different stories of different nations. Some have failed, yet some have been triumphant in beating the COVID-19 virus. But these success stories have common denominators. Yes, each successful country has its own special ingredient to success, but similarities between these countries' steps are evident. Among the three countries, namely Vietnam, Australia, and New Zealand, such common factors in squashing the COVID-19 are countries taking into account that COVID-19 is a real serious problem. Just like how New Zealand and Australia immediately closed their borders to China as a precaution, and how Vietnam started its early preparation in aggressive prevention of virus as strict policies, which were also implemented by the two other mentioned countries. The three countries also took great initiative in listening to the experts, forming groups that will focus on eliminating and dissemination of information of COVID-19. The country leaders of the mentioned countries have showcased good leadership on how to take on a global challenge. Thus, citizens have no problem of following protocols, creating a sense of nationalism, which is not hard as transparency among these countries is evident. The country's success story is all a product of a government that protects and cares for its people, not just their people, but all of its citizens.